Yes, hi, my name is Patsy Page. I'm the Oncology Social Work Supervisor here at the Cancer Center, and I supervise two other social workers. We work together to help patients with their psychosocial needs and help them identify resources. We all know that cancer is a very difficult disease, and when patients are going through treatments, their chemotherapy, they could be here once a week, they could be here for several months, and with radiation therapy, they're here 5 days a week. So cancer doesn't take anything off the plate for our patients, it just adds even more things for them to think about. What we like to look at is, other than the wonderful medical treatment they're getting, what else might be a concern for these patients? Do they have child care issues? Do they have issues in transportation? Can they put gas in their car if they're driving from a great distance? What about their house payment if they're no longer able to work and that mortgage is due and they're too worried they can't focus on their treatment because they're worried that they're going to be evicted from their home? What if their electricity is turned off and they're oxygen dependent? Can we help them with some paying an electric bill or paying a house payment for them? If they don't have insurance and they need to have medication, we can use Friends of Cancer Center funds to help pay for those medicines, especially the pain medication. So that's what we try to look at. Other than the cancer itself, what else is going on in their lives and what else do they need help with?
My name is Corinne Schaefer. I am the reimbursement analyst here for the Cancer Center, and I'm here for any kind of financial assistance that patients might need. I'm kind of one of the hidden little secrets of the Cancer Center because I on the back side, the financial side, I work the accounts, make sure that all the tests the patients have approval from the insurance company so that they have everything paid for by their insurance, get everything set up in place so it's something that they don't have to worry about, getting authorizations for their medications, because a lot of the patients with medications, they need authorizations before they can get it. So I work on that side of it, and then any questions they have with the billing, I'm the one who steps in and looks at accounts and to verify, was things processed correctly? Do they have to go through another step? Because there's a lot behind the financials, and these patients, they don't need to have that any part of their life or their well-being, tempered with or messed with because the stress of insurance companies, because insurance is stressful. So I'm here to relieve that stress so that they can focus on treatment, they can focus on themselves and focus on getting better. Our cancer patients, they don't just get a bill from one place. They get bills for pathology and anesthesiology and radiology, and they get all these bills in the doctor, in the hospital, and it gets very confusing, and they don't know what to do, and they're overwhelmed, and it's understandable. So it's, the most important thing is just, I am here to answer their questions, and honestly, and I'm probably going to regret saying this, but I have yet to have a problem I couldn't solve for a patient. So it's one of those where I don't give up the fight. I keep fighting for them, as much as it's necessary. I always encourage them to please call me and just let me know. Come in, stop by. My door's just, it's always open. I'm just down the hall. So I'm always here, and, I'll find that answer for you, and I'll take care of it, so don't worry about it.
In addition to wonderful doctors and treatment staff here who provide the medical care, we realize there are a lot of other parts of cancer care, and so we have the OASIS Complementary Medicine Program, and within that our patients are able to get massages, healing touch, reflexology, and also we started about 3 years ago to add art to a part of our complementary medicine program. So our patients can come here once a week. It's their own support group. Everybody who comes is either a patient or a caregiver of a patient, and we let them spend 3 hours together every Friday afternoon, celebrating survivorship, talking to each other, getting a lot of support, and at the same time creating something beautiful to take home with them as a part of their journey. It's a wonderful, wonderful addition to our cancer center. Our patients have really given it rave reviews, and I think probably the best part of it, in addition to the emotional support, is because of the funds we raise through our ribbon walk every year. Those funds pay for the artist, the paints, the brushes, and the canvas, so it costs our patients absolutely nothing to come and do that. Because chemotherapy and radiation, is expensive. Cancer care is expensive, so we look at what is something we can do to help these patients that's not going to cost them any additional funds, but it's going to bring another component of support and love to them.